when we talk about compassion fatigue within the veterinary profession, having to deal with euthanasias and emotional grief from families is something that does weigh heavily on veterinarians in general. Within the veterinary profession, suicide is very high. It's one of the highest rated professions in the United States. Not just because of euthanasias, but there's a whole slew of things. But it is a contribution when you talk about dealing with other people's emotions. I
Right.
think personally for me, because of what I practice with intentionality, that intentionality and mindfulness, they're passions of mine. So
Yes.
I'm very aware of my emotions. And
Mhm.
so I think that because of these other practices that I do with meditation, etc., I have an ability to cope with those emotions because when they come up, I know how to address them and how to deal with them and how to release them. Sometimes you have to let
Mhm.
them come up and go through them, but I also know how to release them, which I think is very important, especially in this work.
Hey everyone, let's start healing. I'm Adrienne Murchison, and welcome to the Let's Start Healing podcast. We have more in common than we think, and what we have in common can change the world. Well, my guest today is veterinarian emergency room veterinarian Dr. Camara Carter. She is a very unique veterinarian, I believe, in that she has a lot of compassion for not only the pets, but for family members of pets. And she euthanizes pets in the home, sick pets in the home, rather than have the beloved family members go to a clinic or an emergency room. And there are other veterinarians who do this. I was so struck by Dr. Carter, Dr. Cece, as some affectionately know her. I was so struck by her when I met her because I have had a number of pets in my life since childhood who have passed away. And I would say most of them have passed away, if not all of them, at the doctor's office. So to talk to someone who is devoted to being mindful and having a pet passing as a sacred experience really touched me. So we have a very nice conversation that I'm looking forward to bringing to you. And she will share with you how, because I don't think that if I had the skills to be a doctor and a animal doctor, I do not think I could do the work that she does, that as a pet owner I really appreciate. And she shares that she has sort of a different relationship or experience when it comes to death that she thinks allows her to carry out this work. So I am so looking forward to you getting to know her. I want to share a little bit with you about her background and her business in the Atlanta metro area is called PeacefulPaw Transitions. So she works as an on-call emergency veterinarian at different hospitals, animal hospitals in the Atlanta metro area. And then she also has her own business as Peaceful Paw Transitions. She is the founder of Peaceful Paw Transitions. She grew up in Georgia. She received her undergraduate degree in environmental science and public health at Harvard University. And we talk a little bit about her interest in environmental science. She went on to pursue her veterinarian degree at the University of Georgia. This experience, she says, provided a strong foundation to be able to practice her passion. After she completed her schooling, She completed a small animal rotating internship at one of the busiest veterinarian hospitals in the country, which is not far from where I am right now. I mean, I would say a couple of miles away. Blue Pearl Veterinarian Services. She now works as an emergency veterinarian and performs euthanasia services for very sick animals regularly. She also experiences the fast paced environment of a veterinary ER. While efficient, she realized that many of her patients and their loved ones, us humans, they could have a more comfortable transition process, something that she would have liked to have had with the passing of her own pets. She says, I not only wanted to offer professional in home euthanasia services that allow families to be in a familiar, comfortable environment, but to also create an atmosphere that supports a tranquil, peaceful energy. Thus, Peaceful Paw Transitions was born. Outside of her profession, she enjoys traveling, bowling, hiking, spending time in nature, finding new adventures such as mountain biking, and spending time with her family. She brings her passion and joy of life into work every day so she can share it with her pet patients and their human companions. She has a fur kitten who you will see in our conversation by the name of Gaia, and Gaia is a white mixture. I would say a white mix Bengal. So again, I just love what she does. And I was trying to think of pet experiences to share with you. I mean, if you have a pet and you're on social media from time to time, you will see some of your friends on social media who are sharing that they lost a pet a day or two ago, and you really feel something in your heart, a great amount of compassion towards that, because either you can imagine losing your own pet or you have lost a pet and you know how hard that is to let go. And I will share that one of my pets, the longest pet that I had, was from childhood into adulthood. I had for 18 years. It was a French poodle, uh, Gigi, and uh, she passed away when I was living in New York. My best friend Tanya and I were sharing an apartment, and I had had Gigi from, gosh, maybe the age of 7 or 8. I used to know this, but 7 or 8 years old. And then 18 years later, Gigi passed away. And the night that she was uh, clearly transitioning, which was so traumatic, I just, I called a veterinarian. We were living in Queens. It was late at night. So the vet that I was going to was not open, and the person who facilitated everything, Gigi actually passed away in my bedroom. And the person that I talked to at the animal hospital was so compassionate, so compassionate. And I'm going to tell you, this was the 1980s, and I have lost a number of pets since then, unfortunately. And uh, it just touched me so much. So the next morning, because this was late at night, someone came and picked her up to take her away. And then I received a letter from the person that I had been talking to on the phone, a handwritten letter. And she sent back Gigi's collar. And it just touched me so much because uh, just the compassion that she had to be on the phone with me that night and then to write a hand note and send it to me. And I think that we find that some of our veterinarians do that for us. And everyone isn't a pet person. Everyone doesn't understand that love. And it touches me when someone does. And that's why I so appreciate Dr. Carter, Dr. CC. So let's meet her. Let's get started and let's start healing. Welcome, Dr. CC.
Hi.
It's so wonderful to have you on the podcast.
Thank you for inviting me.
First of all, me and some close loved ones are serious, serious animal lovers. And what you do, I want to go into your background, but for I have to say that what you do is so powerful to me because I've had a number of pets. I have pets for years, like 18 years, 14, 15 years, but I have had a number of them pass away in the veterinarian's office.
Yeah.
And so this is or even at home, period, it's a lot. So what you do already let me say thank you for what you do.
Well, thank you. I appreciate it. And that's, our goal is to create a more comfortable experience for families. So that is definitely what we're here to do.
Yeah. Well, the first thing I wanna ask you is when I was looking at your bio, you you first studied public health, is that right?
Yeah. So for undergrad, I went to
Yeah.
Harvard University, graduated in environmental science and public policy. My thoughts there at the time, I wanted to be a wildlife veterinarian. And so my thoughts in concentrating, or they call it concentrating, but it's majoring in environmental science and public policy, is that wildlife, humans, the environment, it's all interconnected. So it was important for me to, I knew I was going to get the biology and everything else in vet school. I wanted to focus more on the environment and develop a better understanding of that aspect and conservation to get a more rounded experience in education.
Okay. So you knew you were going to vet school after your
Yes,
undergrad.
I did. I
Okay.
did.
And well, what would wildlife have looked like? What type of wildlife if you had pursued that?
Well, I don't know. And that's why I kind of switched gears in school, because I learned that um, the wildlife veterinarians, in the typical sense that you think, going out into the environment, doing environmental conservation, a lot of times the veterinarians are the ones doing the paperwork, whereas the biologists are the ones that get to work with the animals. So I kind of switched gears, but I've
Mhm.
always had an interest in the interface between human and animal medicine. And it's still something that in the future I would like to explore. I just am still deciding and determining what route to go in to do that.
Yeah. And pardon me, but what do you mean when you say interface? Like, I find that so intriguing. What do you
Yeah.
mean?
So really the concept of One Health, kind of what I mentioned before, the idea that there is a connectedness between the environment, between animal medicine, between human medicine. Some people don't realize how similar human medicine and animal medicine is. Medicine is medicine. The difference is that in veterinary medicine, we learn multiple systems, whereas in human medicine, you're just learning about the human body. So, and still, my answer to this is not fully fleshed out because I don't fully know myself, but
Mhm.
um, some way dealing with that connection similar to what they do in public health, like at the CDC, for example, epidemiology, working with infectious diseases. That's one example of that interconnectedness between animal medicine, human medicine, the idea that there are some diseases that can be transferred from animals to humans.
Really?
It's all, there's a lot of ways and routes that you go. I'm not necessarily interested in the infectious diseases, but I'm still trying to figure that out.
Yeah, yeah. Well, so did you know that you always wanted to be a veterinarian since childhood?
I did, yes. I've always, like most veterinarians say, I always loved animals.
Yeah.
But I've also, my parents are physicians, so I've also had an appreciation for medicine. And for me though, I wanted to. My interest was in learning multiple systems, not just that one human body system, but being able to learn about, a cat and a dog. They're not the same.
Right,
A cow and a dog, not the same. Very
right.
different systems, and that's what I really enjoy.
Yeah. Well, what type of doctors are your parents?
So my dad used to do emergency medicine, moved to urgent care, occupational medicine, and my mom, he's still practicing. My mom used to do family medicine. She's retired now.
Okay. Wow.
Oh, and she also, my mom, actually, after she retired, she got board certified in lifestyle medicine, which also kind of similar to the connectedness with humans, animals, the
Yeah.
environment, more importance of what you're, the importance of eating, the there's a focus on the foods that you're eating,
Mhm.
exercise, all of that, preventative.
Yeah. I love that.
Hmm.
Wow, that's a whole lane I'd love to go down. I love that. So, okay, let's get into your love of animals, and, behind you is
Yes.
Gaia, and Gaia is a Bengal,
Yes, she's a Bengal cat. Hmm.
and what type of cat when is she I don't know, I'm thinking the wild when I hear the name
Bengal.
Bengal, yeah.
Well, she's a purebred cat. So purebred animals, they're mixed between. She's a mix between an Asian leopard and a domestic Asian leopard cat. Sorry, and a domestic cat. Down back many generations, but not all. So I have a Bengal cat because I love them. I love their personalities. I love their patterns, but the important thing to know is that you don't have to have an animal that actually costs money. You can
Mhm.
get There's plenty of cats at the shelter that need homes
Yeah.
that and also animals. I love the stories that my families have when I travel to their homes. I love the stories about the animals that find them, like they show up on their
Mhm. Oh,
doorstep
yeah.
and don't leave. Oh, I love
Yes.
those stories.
Don't get me started.
Yeah.
Yes.
Yes. So that's definitely something that's important to know. You don't have to purchase an animal. You can there's The shelters are too full right now, and there's
Mhm.
that need homes.
So, in a do you do in addition to your specialty,
Mhm.
do you work in at a veterinarian hospital in addition
So
to your
I do
specialty?
relief emergency medicine, and what that means is, so I'm an emergency veterinarian. Relief meaning that I travel to different hospitals, pick up shifts as they are available and as they need help. So I have a lot more flexibility with my schedule and quality of life.
Yeah.
Mhm.
Wow. And so is there a big need? Is there a lot of big need for your services in terms of filling in? Are there
Th-
enough?
There's a big need for veterinarians across the board. Yes,
Really? Wow.
definitely. Hmm.
Wow. So how did you decide that you wanted to start doing euthanasia in home, in the family's home?
Good question. So the idea actually came to me from one of my colleagues. At the time, she was a vet assistant who had her own business in a different state. She suggested it, and I said, "Oh no, I don't know about that." But then I actually thought about it, and especially working in the emergency room, we get a lot of euthanasias that come through, if you can imagine, because that's the most emergent cases. A lot of
Mhm.
times, or sometimes, they don't make it. And so, for those instances, I had a lot of experience with euthanasias, and I also noticed that there's a way that we could make it more comfortable. Um, Not only did I notice that, especially after my a colleague told me about the idea, not only did I start paying attention to how we could make things better, I also wanted to add a unique component to it, um,
Mhm.
that is important to me. So in my life, intentionality is very important. Being aware of what I'm thinking, who I want to be as I move through the day, being very intentional about how I'm speaking to people, how I'm moving through my day is important. And that's what I bring to my business. So, what's unique about us is the holistic component. For us and how we go about things, when we go into the homes, we like to take the holistic approach. What I mean by that is taking a broad view of the entire atmosphere when we're there. So we don't just go in, euthanize, and leave. We utilize candles, soothing music, aromatherapy to create the most calming, comfortable experience as possible.
Yeah.
And most of my families, they love that experience.
Yeah.
Some people don't necessarily aren't really into the aromatherapy or don't necessarily want to do that, which is fine. We cater to their experience. But regardless, at every step, we are very intentional about the type of energy that we're bringing into the home.
Yeah.
So, what a lot of my um, families don't see is what we do in the background and prior to entering the home. I've trained my assistants that work with me to pay attention to what they are thinking, the type of energy they do want to bring into the home, the type of energy that they want to leave at the door. Maybe they're having a bad day that day. Recognize it before going in, leave that at the door. So the only thing we're taking in is what we have intended. And
Right.
so prior to our visits, we will have a discussion about what that particular case is, who the animal is, who the family is, what we know so far, and then talk about what our intentions are for the visit. So, be it our intention is to radiate love from the moment we walk through the door, or comfort, or grace, whatever it is, that is our focus throughout that entire visit.
Yeah. Oh my gosh, I'm thinking as you're talking, 2 of my I have a dog now, but I had 2 cats that I had, 2 separate instances. When it was time to take them to be euthanized,
Mhm.
they literally asked me. They literally, like, looked at me and, like, called out to me, like, "Please." Like, does that seem common to you?
You
I mean,
mean your cats? You're talking about your cats, right?
yeah, yeah, like the way that they express themselves, and these are years apart, they were just like, "Please." And I mean, one of my cats was always laying down, I knew
Mhm,
that I was going to take him the next morning,
mhm,
but, he sat up and was like, "It's time, you have to do
mhm,
this now." And
mhm.
another cat was very, very similar, and I find that so interesting. Does that seem
No,
not
definitely.
unusual?
I definitely resonate with that. I've had experiences in some of my visits. So there are sometimes every visit is unique. I'll start by saying that every visit is unique. So I can say this is what the medication we give to sedate your pet, and this is the next step. This is the next step. But sometimes the pets, they are beings. They do things their own way, and I know I've had some experiences where it we give the appropriate amount of sedation for their weight, and they just will not go to sleep. And
Ooh,
in some of those cases, I've noticed that there may be a significant attachment by maybe a child or a teenager
yeah,
or one of the family members to that animal. And sometimes I encourage them to tell them it's okay to it's okay to let
yeah,
go. It's okay to move on. I'll be okay. And
yeah,
you'll see that they, eventually go to sleep. So, yes, I definitely
yeah,
resonate with that. I've also experienced a few instances. A lot of families ask me, can we have other pets around during this time? And this is something that I definitely encourage because I think it's good for closure.
mhm,
And different animals react differently. Some will walk. I had one dog once their friend, their sibling passed away. The family let him out, and he went everywhere except on the blanket where the pet was laying.
mm,
Others act like nothing happened, or others, I've had one where this was I think the most interesting one I had. The minute I started giving the medication to facilitate the transition of this animal that was very sick,
mhm.
the sibling started whimpering
Oh,
and then came over afterwards and sniffed. So they always know. They
yeah,
express it differently.
yeah, and when you were talking about intentionality, I was remembering how one of my cats that I had euthanized, a friend went with me and she did Reiki
Mhm.
on her.
Mhm.
And, I could tell by the way she was responding, my cat, Frangelica was her name. I could tell she was feeling, her energy in a positive, in a good way.
Mhm.
So it's so
Yeah, that's beautiful.
Yeah,
Mhm.
yeah. Well, how do you um I I I want to get back to some details about your business, but how do you maintain your own emotions? Like, I don't know if I could do what you do, even
That's
if, like, let's say I had the skills. I don't think that I would be able to emotionally handle it.
that's a good question. I actually get that a lot. I think that for one thing, for me, I've always had a different relationship with death. That I don't know where it came from. I, particularly when it comes to animals, I don't I don't take in that grief the same way that a lot of people do. It doesn't mean that I don't care and I'm not aware of, you
Mhm.
know, my family's feelings, but what I think it does is it puts me in a good position to do what I do so that my focus is on facilitate just providing space for my families to experience their own grief. I
Mhm.
also, with intentionality, part of that is paying attention to the energy of my family and the energy of the pet that I'm dealing with and listening, you know. And so with my families, for example, I if I if my focus and my intention is on healing most effectively and creating the most positive and comforting experience as possible, then because my focus is there, I'm not as focused on the grief side of it.
Yeah.
And then also for me, a lot of times, what we're doing with these euthanasias is a blessing. So it's not something that is obviously as widely accepted for humans,
Yeah.
but there are humans that are very sick that would prefer to end that pain. And
Mhm.
so the blessing that we have as veterinarians and that can perform euthanasia is that we can facilitate a transition that ends suffering. And so
Right.
in that, there's also a blessing in it that I choose to focus on rather than the
Right.
grief. It
Right.
doesn't mean it doesn't always hit me,
Yeah.
but those are some of the tools that I use to cope with it.
So are there anything around mental health that might be hard in terms of this work that might, be weighty?
Give me just a few minutes to think about this one because that's a good question. I think that in general, amongst the general veterinary population, yes. And it's one of the things that when we talk about compassion fatigue within the veterinary profession, having to deal with euthanasias and emotional grief from families is something that does weigh heavily on veterinarians in general. Um, and within the veterinary profession, suicide is very high. It's one of the highest rated professions in the United States. Not just because of euthanasias, but there's a whole slew of things. But it is a contribution when you talk about dealing with other people's emotions. I
Right.
think personally for me, because of what I practice with intentionality, that intentionality and mindfulness, they're passions of mine. So
Yes.
I'm very aware of my emotions. And
Mhm.
so I think that because of these other practices that I do with meditation, etc., I have an ability to cope with those emotions because when they come up, I know how to address them and how to deal with them and how to release them. Sometimes you have to let
Mhm.
them come up and go through them, but I also know how to release them, which I think is very important, especially in this work.
That is so interesting. I hadn't heard that phrase before, compassion fatigue. And that comes from receiving the energy and having empathy for the emotions of the family
Hmm.
around the pet.
Hmm.
I'm just want to make sure I understand that, right? Am I right with
Yes.
that?
Yes, and there's more to it. I wish I had the definition in front of me, but because it's an actual thing within the veterinary profession, but it's also dealing with. There's a lot to it. It's dealing with, for example, like working in the ER. you're in a situation where you have most, like I said, most veterinarians, small animal veterinarians, they are here because they love animals. And a lot of times what you see is situations where families will come in, they're going through their grieving process because you have a pet in the ER. It's just like, as a family member in the ER,
Yeah.
it's very
Mhm.
high emotions at the time. But then there's also the expense of
Mhm.
of medical bills, which a lot of people don't recognize. So, quick, I definitely want to push for pet insurance because a lot of people don't know you need it.
Yes.
Costs are getting more and more expensive.
Yeah.
And so what ends up happening is the veterinarian gets blamed. So what a common phrase is, well, aren't you supposed to love animals? Why are you charging me? And it's like, well, you still have to make a living. This is still a business and a job, and that can weigh on veterinarians as well. So
Yeah.
I got the definition of compassion fatigue. Essentially, it's the cost of caring for others or for their emotional pain resulting from the desire to help relieve the suffering of others.
Yeah.
So, yes, that's just one other example. A lot of
Yeah.
causes for that, but yes, it's a real thing.
Yeah, and I appreciate hearing that because that is something that I think about with veterinarians. I mean, me having lost pets, I
Mhm.
mean, it's so hard. It's so hard, and then it is expensive. I have not had pet insurance, which I
Mhm.
know it's how important that is. I, of
Yes.
all people, should know this,
Yes.
and I do feel like now I've had some really nice, compassionate vets, but I also feel like that they sometimes can play on your emotions just by suggesting, well, we could do this. Let me give you an estimate. And the estimate could be 500 to $1,000 for something that might not be necessary. And
You're saying
so,
from the owner's standpoint, getting an estimate for things that may not be necessary.
yeah, now yeah. And I mean, that's happened to me a couple of times,
Mhm.
at least twice that I can think of. And so, I mean, and then my pets, it hasn't been dire situations where my pet one was the vet said to me, she was suggesting, I didn't even there was no way I thought my dog was gonna pass away. I was
Mhm.
just taking him, to the vet. And they told me that he was, he's dying.
Mhm.
Okay. They
Mhm.
told me he's dying. And she suggested some things that added up to like $500.
Mhm.
But what she really felt was even these tests are not going to do any good.
Mhm.
That's what she really felt. And I did what she recommended.
Mhm.
She thought he only had a couple of days to live. And she suggested that I go home. She thought Monday, it was Saturday morning. She thought Monday at the most,
Mhm.
he would make it to. But she said if necessary, go to this emergency hospital.
Mhm.
And that's what I had to do on Sunday.
Mhm.
So it's just an example of, okay, well, just in case you want to spend $500, this is what we recommend. And the same thing happened when there was something on my dog's eye at the veterinary specialist. I'm in Sandy Springs too. That's
Mhm.
24 hours.
Mhm.
And um, the doctor wanted me to spend $1,000 for a thing on his eye that had busted. And I said, well, I think it's just that it busted. So I'm going to take my chances. And that's, it was fine. But
So, for your examples, I appreciate hearing them because they're from the other perspective, from the client. I think that in some cases there can be a education can be done a little better, because even hearing what you're describing, the second example when you talk about the eye, sometimes families think that, oh, they're just trying to take money from me, when that's not the case. So for what you're describing, I don't know, obviously I don't know
yeah,
exactly what was going on, but whenever you're dealing with something from an veterinarian
yeah,
standpoint, whenever you're dealing with something that is related to the eye, it's not something that we want to play with, because if it's something serious, the eye can it can it can decline very quickly, and it can lead to blindness. And so we're going to do what we can to give you the gold standard. What I think is important, and I don't know, the situation that you dealt
Sure.
with,
Mhm.
is providing gold standard. This is what is recommended. This is the best. Our If we were to do everything, this is what we do. Giving that plan and then giving the other options as well, because of course, not everyone has the funds to facilitate treatments and diagnostics, but it's providing those options and then also discussing the importance of why we are recommending what we are recommending.
Mhm.
And I think that helps when it comes to um, families feeling like, oh, well, they're just charging me. Most of the time, no, we're not just charging you. These tests are for a reason. Because
Mhm.
fortunately, I'm glad that you said everything was fine, but it could have gone a different direction. And if
Right.
the vet didn't recommend that, then now that's a liability on them, you
Yeah.
know?
Yeah.
So
And would you speak a little bit to certain breeds of animals have certain ailments that might be common to them, to
yes,
the
definitely.
breed?
Of course, I don't know all of them, but
Yeah.
I know that there are certain breeds that come in through the ER for certain diseases. For example, your small breed dogs like your Frenchies and your blanking on one that I want to say.
Not
Dachshund. So your Yorkie, I mean your Frenchies, your Dachshunds, small breed dogs, they tend to get disc herniations a lot more readily than larger breed dogs, and so
Mhm.
they can come in with symptoms ranging from back pain all the way to acute paralysis in their back legs.
Mm.
So that's one example. Or you have certain breeds of dogs like labs, or actually, let me do so golden doodles,
Yeah.
Labradors, those young golden doodles, Labradors, young dogs like that. They always eating things, so they come in with a foreign body very often.
Oh, and more common than other puppies.
Any
So
puppy can eat
yeah.
things, you
Yeah.
know.
Yeah.
Cats too. My cat, when she was a kitten, fortunately, she did not eat foreign material. But any kitten, any puppy, it's always something that you want to pay attention to. It's just
Mhm.
that we have certain breeds that we more commonly see coming through the ER.
Yeah. Oh my gosh. I'm
Dachshund.
I'm just thinking about, like, you and the I would wanna take all of these pets home if I could. I just so because I did work at a vet,
Mhm.
for 5 minutes,
Oh,
and they would be at Pets Are People too,
what did
and
you do?
I was, like the front desk person.
Okay,
Yeah, and
important job as a vet.
yes, and they would have, they had a boarding section upstairs,
Mhm.
for some of the smaller breed dogs, and I would go in there and just hang out with them and just feel like, "Oh my gosh, if I could just take you home."
Yes, I know sometimes the temptation is hard to
Yes,
resist.
yes. So you have, different types of services, right, for your
Business.
yeah, for your business. Would you describe that? Because it could be, especially in terms of their remains and
Oh, with
yeah.
aftercare.
Yeah,
Okay.
but even during the care,
Mhm.
you have could you describe some of the process? You mentioned the preparation, the
Mhm.
sedation, and the keepsake package,
Oh, okay,
and
okay.
then the aftercare.
Yeah. So I talked a little bit about the holistic and intentional
Mhm,
aspect of it. For more of the medical aspect, the first thing we do with our pets in the home is give them a sedative. And it's a quick injection into the muscle and takes them a few minutes to go to sleep. During that time, if the animal's still interested in eating, I encourage giving treats or, still talking to the animal as they're going to sleep. Because then after they're asleep, that will be the last time they're awake. And then after their sleep, we will then place a catheter into their vein to gain access so that I can then give them medications to facilitate the transition. But the entire time, what we like to do at Peaceful Paw Transitions, we like to take on a celebratory approach to this experience because Of course, it is a time to go through the grieving process. It's also time to celebrate life. So we like asking questions to hear about the pet's life and to hear about memories and stories of what their favorite thing was. I've had all kinds of stories. Families who have traveled with their pets all over the world. It's really a great way to focus on the laughter and the memories during that process.
Yeah.
And then after the transition, we leave our families with a few keepsakes, a
Mhm.
paw print, and then also I make these memorial fur lock jars to keep a lock of fur in, and then also an engraved rose quartz crystal. And the rose quartz crystal represents um, unconditional love, and it's a good crystal for emotional healing, especially during times of grief. And
Yeah.
so it says forever loved on it, and it my family, some of them put it with a paw print or carry it in their pockets. They can do whatever they want with it. But that is what the process in the home.
Mhm.
Now, some families, in terms of aftercare, there's different options. Some families choose to do home burial. And I will say, if for any family interested in doing home burial, it is very important to check your state and local laws because we're giving a medication that if wildlife gets to the remains, it can poison them. So, and that
Mhm.
is something that the laws are in place to help prevent. So
Mhm.
that's very important. But other families choose what's not as common are pet cemeteries. Some of the crematories have, like Pet Angel, they have pet cemeteries. Some families like to buy a lot out there to bury their pets. Most families do cremation. With cremation, there's two options, either private or communal. With private cremation, that means the pet is cremated by themselves or individually, and the family would receive the ashes back in an urn versus communal, they're cremated with other pets, and then the crematories will then do whatever they do with the ashes, so spread them out in nature, however they deal with them. Most of the time, it's out in nature or has something to do with the environment.
Mhm.
Yeah, so that's the process, and for cremation, that's something we arrange, and we arrange for transportation as well. So the pet would leave with us. We take care of all of that.
Mhm.
They don't have to worry about transport.
And so do you when you arrive, do you have an assistant with you
I do.
or
I go with, an assistant.
Uh-huh.
I have a few people who work with me.
Yeah.
Um, and one thing I forgot to mention is that when we the benefit one of the benefits of going into the home to, facilitate these transitions is we can do it anywhere that the family wants. So outside in the backyard, if they love to be outside under a certain tree that they love. I had
Mhm.
one family, they wanted it to be performed on a specific step because that was always the step that the dog would stop on and turn around to wait for the
Yeah.
owners to follow. So anywhere in the house, which is a very nice addition to that comfort.
Yeah. How long have you been doing this? When did you start Peaceful Paws?
I started in 2022.
Okay. So
Mhm.
after the pandemic.
Mhm. Yes.
Yeah, yeah. And you mentioned that, the shelters, and I do know, I'm aware of how busy full the shelters are. Have you
Mhm.
seen that increase, been aware of that increase since the pandemic, or was that
I
way before?
So don't hold me to this.
Okay.
I don't know for sure, but I think from my understanding, so there's definitely a huge increase during the pandemic to the point where shelters were overrun, and they couldn't accept any patients from us or from families who would call for
Yeah,
pets who didn't necessarily need to be euthanized. But since then, I'm pretty sure that it's been pretty consistent. I don't think it's decreased since then, but that's the
yeah,
part that I'm not sure on.
yeah, yeah. Well, I want to talk, some spirituality,
Mhm,
and especially with, you talking about the mindfulness and the intentionality. And
mhm.
so will you talk about your spirituality, and is it rooted in any particular aspect of spirituality or faith, or, just about and for me, I have guests on who I refer to my higher power as God. Some
Mhm,
people refer to their higher power as higher power, or universe or
Hmm.
nature? And so how do you refer to this? And can you kind of describe your relationship in the, I'm saying a lot, but how important it is, for you to walk through the world in the way that you do?
Yes. Okay. So for me, I don't consider myself religious, because I feel like when we get into religion, and this I have I'm not saying anything against anyone who does follow a certain religion, but for me personally, I feel like when we get into religions, now you're starting to follow doctrine rather than seeing the connection between different religions that exist. And so for me, my focus is more spiritual. I would say that my belief is that there is this energy that exists that we are all connected to, we are all a part of. And but we don't necessarily recognize the connection that we have, nor the power that we have to create our own realities. And that's a very big one for me, especially when it comes to intentionality. I am very much a believer that through how I live, through the thoughts that I choose to think, and what I choose to pay attention to, and how I choose to imagine my life, I create my reality.
Mhm.
Um, to answer your question about, I'm trying to remember everything you asked. Um, what I so
So
some of the I like to read and listen to different people who are within this world of self-growth and transformation. I think it's important to listen to multiple people or take in knowledge from
Mhm.
multiple sources. So a few people that I listen to or read are Joe Dispenza, Michael Beckwith,
Mhm.
Neville Goddard. I'm currently going through his
Mhm.
collection of books now. That's just a few. There's definitely
Yeah. I
more.
knew you were gonna say Joe Dispenza.
Yes, Joe Dispenza, yes.
I knew you were gonna say him.
I think what I like about him is he, especially for people who come from have a science background or want a foot more in that scientific world, he does a very good job at explaining things from a scientific standpoint and also a practical standpoint. So, like, for example, the idea of paying attention to your thoughts. He talks about how 90% of the thoughts that most people think they're not even aware of. But when you start paying attention to them, you realize that a lot of the thoughts you're thinking are not things that you want to live by. Like you're seeing yourself as unworthy or, you know,
Mhm.
things like that. So that's why for me, it's very important to be very aware of what it is that I'm thinking so that if it is a thought that I don't want to live by, I can change it. And for those who are starting the journey, it can be difficult. But the important thing is to stick with it because then you start noticing how those thoughts that you are thinking fade away, 'cause as you start
Yeah.
paying attention, putting your attention on other things.
Yes. Yes. I'm completely with you. I study A Course in Miracles,
Hmm.
and it's very much aligned with what you're describing. Yeah. Is there a time, an activity or moments in your day when you feel the love of that energy? Is it something that well, if I go for a walk in the park, or if I'm, with Gaia, like sometimes you might just feel that love, that energy, like viscerally inside you that you're connecting with?
Yeah, that's a good question. I think for me, it is more of a conscious effort in feeling that. So for me, what I mean by that is I will go through my day focusing on certain feelings and emotions. So if I am focusing on just abundance or just love just radiating from me and coming to me, the way that I approach that is as I'm moving through my day, as I'm talking to people, as I am, with Guy, as I'm moving through my world, I feeling my heart opening and radiating light and radiating love during my day. I do
Mhm.
like what I've recently started doing is walking in the park. I really like being able to move as I am focusing on a particular idea or a particular version of myself. Um,
Mhm.
because I think that it helps me in my ability to pay attention. What am I going to pay attention to? This outer world, or am I going to pay attention to the version of me that I want to be, whoever that is? If I want to be unapologetically confident, which is something that I've worked on in my past, um, how does that feel? How do I walk as that person? How do I talk as that person? How do I move as that person? And so that's kind of how I approach it, is being very intentional about my about paying attention to who I want to be throughout my day. It's very
Mhm.
easy to, and I've done it several times, to realize that you're no longer you're no
Connected,
longer thinking about what
present.
you're supposed to be thinking about. You've gone off to whatever I don't even know what I was thinking.
Yeah,
But as you go through this journey and start paying more and more attention, it's easier to pull yourself back into alignment with that version of you that you want to be.
absolutely. Absolutely. So I usually ask, and then you can answer this if this applies, but I kind of want to ask you this question in a different way. I usually ask people, is there a time when they received a miracle or a blessing and they knew that that was none of their doing, that that was completely God? And so I'm wondering, you can either answer that that way, or I'm wondering with you if there is some miracle or blessing that has taken place as a result of your spiritual practice that you're describing,
Okay.
that before you were so ingrained in your practice and devoted to it, this might not have happened. Like this is a result of, my walk right now.
hmm For me, I think both questions are the same, because for me, I believe that we are all God. So to say, is there something that happened that was not my doing, but was God's doing? For me, it's not recognizing that you are creating everything. So you may have unconsciously created that and brought it to you, but it's still something that you are creating by aligning with that energy.
Mhm.
Um, I'll use an example. I'll actually use an example from before I got really heavy into this work. So I've the way we grew up, we've always had, my sisters and I, a mindset about paying attention to our thoughts. My mom would always say, if we said something that you didn't mean, XX cancel, cancel, XX cancel, cancel. So we'd always have that growing up. And I remember in high school, my first year of high school in ninth grade, my brother told me about there's Frank C. Kids Foundation. And they were putting on a contest for students. 10 students would win a free trip to the Amazon. And so he told me about it, and I went and looked it up. And you had to write an essay on, I don't remember specifically what it was about, but essay on, if you were president, what would you do to conserve the environment? But it was due that day, and it was already afternoon, so there's no way I would get it done in time. But I knew I wanted to go to the Amazon for free. So I remember just sitting down and just seeing myself in the Amazon, just feeling myself being in the Amazon. And this was before I really got into the full practice of what I do, but just visualizing it, just sitting down, but more than visualizing it, actually feeling myself there. And in doing that, I did that day, I started working on the essay, and then the next day they said they extended the deadline for the competition. So I got it in on time, and then they invited 20. Sorry, they invited 20 students to speak at Zoo Atlanta. So you had to present as if you were president. Did that, and I was one of the 10 students that won the trip to the Amazon, won the free trip to the
Yeah.
Amazon.
Yeah.
So that was one example.
Yeah. Yeah. No, that is I relate to that so much. I relate to it so much. And it's so powerful, when you see the effects of that. And
Yes.
speak to this, because even as I'm saying it, I'm thinking about, a lot of people talk about manifestation, and it's really, to me, it's not about manifesting that trip, right? It's about, to me, the beauty of this and what we are. Like the
Yes.
same thing that you just said to me, how, we are God. And to
Hmm.
me, it's about what it's a reflection of, the
Yes. And
power that
that
we have within.
goes along with what like Joe Dispenza talks about. It's who you're becoming, not necessarily, because he talks a lot about people who heal themselves. It's not necessarily about the healing, it's about who you become. Or even Neville Goddard talks about it's about changing your concept of yourself, your perception of yourself. And
Mhm.
that's the journey that you remember, and that's the journey that is fun and exciting. And sometimes it's not always fun. I'm not gonna, sometimes it's very hard. But ultimately it gets you to what you're envisioning.
Yeah. And so how did you get on this path? Like, what path were you on before? Or did you feel a pull, or you knew there was something different
So
for you?
I'll try to answer this as best I can. But so my as I mentioned, my siblings and I, we kind of grew up with some of this mindset. So when we grew up, we went to a non-denominational church, Hillside, uh,
Oh, I know Hillside.
what is it?
International Truth Center.
International Chapel of Truth Center. We grew up in that church, but what they taught was kind of these concepts, the idea that we are all God, you know,
Mhm.
paying attention to your thoughts and intentions, all of that. So we kind of grew up in it, but it wasn't until college that I became more college and then vet school that I became more dedicated. I can't really tell you why. I've always had a dedication, a drive, a devotion to something that I'm interested in. So I know that it started out with when I was young, I was very shy. And that was not the personality I wanted to have. I wanted to be comfortable in my own skin. I did not want to care what other people thought about me. And so I remember even in high school, when I was in high school, when I went to ninth grade, I said, okay, I want to be valedictorian when I graduate so that I could force myself to speak in front of the entire
Mhm.
school, which is what I did. But by the time I got to be valedictorian, I was already a different person than
Mhm.
who I was in ninth grade.
Yeah.
Still shy though. So it's still something that I worked on, and it's always a life journey,
Right.
but something that I worked on through college and then into vet school. So
Mhm.
I think that what drove me was of the challenge of the idea that, oh, I don't have to be this way. I don't have to, there's nothing that is making me do this but me. How can I become a different version of me that I want to be? I love the idea. There's something about self growth and transformation. It is truly my passion.
Yeah.
There's
Yeah.
something about the idea of challenging the way we think about the world. Um, in a way that expands us that I love. And so I think that's why I've ever since, I guess, college, vet school, I really started getting into this work because that's what it does. It challenges you to look at the world differently,
Mhm.
and not only look at the world differently, but interact with it differently. Who
Mhm.
can I be in this world
Yeah.
that I can't even see now, that most people around me can't even see now because we are not in tune with that way of thinking.
Yeah.
That's what I love.
Yeah. And I love how you are the idea of being accountable for how we show up.
Mhm.
And the best example that I heard about this was years ago. Every time I bring this up, I think I should know this woman's name because I bring her up. But she was a woman. She was a scientist. I want to say let me not lie about what kind of scientist, but she was some kind of scientist. And she had a stroke at home, and she wrote this book called My Stroke of Insight. And
Mm,
so I saw her on Oprah years ago, and so the book was about how she had a stroke in her home office, and she didn't she was alone and didn't understand what was going on with her, and she had to figure out how to call someone. And so
Mhm.
she saw numbers on, a card, but it was just the design when she would see the numbers, but
Mhm.
she just had to match them up, to make a phone call, to
Mhm.
call who she needed, to let someone know she needed help. But when she was in the hospital and she couldn't speak for herself, her mother was her advocate
Mhm.
and her guardian, like by her bed. And she became so aware of the energy that people would bring into the room.
Mhm.
And, that her mother would block them and say, no, you have to go, because she was protective of the
Mhm.
energy that she would allow to come to her daughter.
Mhm.
And that to me, was just so clear about the energy that we bring.
Mhm.
And we are responsible for how we show up.
Mhm.
And so I just love, that you're so mindful of that, and you want to be that way. And nobody's perfect, obviously, but it's a focus that you have all day
Yes.
long.
Yes.
Yeah.
How can I my goal in life is to positively impact the lives of others in a unique way. So how can I do that in a way that just provides light, love, and harmony for the world?
Yeah.
That's what I'm interested in as I go through this journey of
Yeah.
life.
Yeah. And without going into politics,
Mhm.
I want to just circle it for a second of, do you think that right now in the world, it's kind of a dismantling in a way, not of any specific issues, but I'm talking about just people. Do you think
That's
it's
a
kind of
very good question. So I'll tell you what I think. My thoughts are so as you go through this, as I've gone through this work, there's always new layers that I'm unpacking, and there's always a new person that I'm becoming, always. And as I go through that process, you feel the old version of you dying off, dying off. Um, but basically, and I love how Joe Dispenza describes this. When you start, paying attention to how, so let's say I'm working on being more confident and I'm paying attention to how I'm talking to people. Am I slumped over, or is my heart being presented?
Mhm.
How am I standing? Well, as you start that process and as you're going through it, that old version of you that has become a habit of you it's going to push back because it's been doing what it's been doing forever. And so then you get all this noise in your head, and it's telling you stop, and no, you can do that tomorrow. And oh, this isn't working. It's not going to work. And it's about pushing through that because you are currently in the process of transforming and becoming somebody new. That's so Joe Dispenza talks about that. I really like how he describes it
Mhm.
from a scientific standpoint. But what I think is you there are I think more and more people are becoming aware of this connectedness and harmony and compassion. And what I think is going on right now in the world, where it looks like we're moving backwards, I think it's just like the what goes on in the body, where it's the noise that is telling you, no, 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 no. Let's come back. Let's do what's normal for this planet. Let's live in that frequency, whereas we as humanity are pushing higher. And we are currently in the process of transformation, and it's about paying attention to that forward movement, that rise in the frequency, rather than being pulled back to the old self that's saying, no, let's go back to the old way of doing things. So
Right.
that's what I
Yeah.
think.
No, I love it. I love it. I just so appreciate this conversation. And one, I want to know if you can share how people can get in touch with you. And can you generally share what your rates are? Because people might be curious about
Okay.
that.
um So, how people can get in touch with me. So, the company is called Peaceful Paw Transitions. The website is peacefulpawtransitions.com. That's paw, PAW, no S, and then transitions with an S. Peacefulpawtransitions.com. So that's one way. The phone number, text message, email are always the best routes. Um, phone numbers on the website
Okay.
as well, and that number they can text that number.
Okay.
Number is 404-500-8816. And we are currently, my sister and I are currently working on my social media. I'm not a social media person, so I'm dealing with trying to get that up and running. So that's a work in progress right now, but that will also be a route moving
Okay.
forward. In terms of prices, I purposely don't put prices on the website because it's really based on um, the individual that based on their circumstances, where they're located, and also what aftercare they choose. I will say that my base price for the in-home euthanasia service itself is 450, and then there's additional pricing for the cremation, transportation. Um,
Mhm.
if they happen to be outside of my range, which is just based on mileage, then it's we still travel. We just add on an extended travel fee to support myself and my assistant.
How far, out extended out into, Metro Atlanta would you be willing to travel? How far have you gone, say, in miles to go to a home?
Yeah, so I don't use mileage from where I live, but for in terms of outside, anything inside the perimeter, in terms of outside the perimeter, I go to Lawrenceville, Alpharetta. I've been to ooh, I'm blanking on the name. A little higher than Alpharetta. I
Johns
can't
Creek
think of
Johns Creek
the
area or Milton?
down to Milton, maybe a little far,
Okay.
but down to Peachtree City, Fayetteville, Noonan, all of that area as well. Palmetto,
Mhm.
Stockbridge, McDonough.
What's been the reaction of people when they learn that you do this? I mean, I guess there are other services similar to this, but have people expressed a gratitude or a gratefulness that this
Yes,
exists?
absolutely. Most um, you can see on my ratings that my families are so grateful for the opportunity to be able to do this. What surprises me is that now there are a lot more companies that exist, and so many people still don't know about in-home euthanasia. They don't know about that option. So that's what most people are grateful for, is just the option to
Yeah.
be able to be at home, have the comfortable experience. And then, of course, with the holistic route, the main phrase that I get is that this was very peaceful.
Yeah. Yeah. It is, I mean, it's so huge. And same thing with, our relatives who might pass away. When you have compassionate medical staff, it's the
Mhm,
same thing with our pets because I absolutely remember, those moments and, the compassion of the people who were there. It means a lot. It's something, I haven't forgotten, and it can be decades ago.
mhm.
So, yeah.
Yes, yes,
Thank you
absolutely.
so much, Dr.
You're welcome,
CC.
and thank you for having me on the podcast.
Oh, absolutely. This was a real pleasure. So thank
Mhm.
you.
You're welcome.